people have asked me how soon that I knew the surgery was successful, and I said within a couple of weeks, but thinking back, I probably knew when I was in the hospital because that pain was not there. Mainly the pain was when I would climb any stairs at all, even one step, and then walking up an incline. I would have considerable amount of pain. And then when I actually would get out of a chair after sitting for some time, I would have a considerable amount of pain with that. It progressed, it kept progressing to the point where I could not move my legs after I stood up from the chair. And I asked Dr. Sue if he thought that I would continually get worse. He said yes. I did not want to get disabled. I was in relatively good physical shape. I had a lot of flexibility. As long as I wasn't standing on my feet or walking upstairs, I actually didn't have a whole lot of pain. And then it progressed. I had physical therapy. I had an injection. He referred me to the comprehensive rehab there in Winston and had the injection. The injection did not help, and a lot of people it does, but it did not help me. And then the next step was surgery. They put the 2 rods on each side of my spine, straightened my spine out, and then put the screws in that go into each vertebrae, and then the 2 long screws that go into my hips, which stabilizes my spine, keeping it straight. And then the 8 vertebrae are fused. I feel great. Even a month after surgery, I was walking on the Greenway that we have here in Wilkes, a mile and a half without any difficulty. In 2 months, or a little over 2 months, I was back teaching my Bible study on Sundays. I am back into water aerobics, and so I continue that. I walked just in a couple of days, didn't have any problems. And even physical therapy had me climb 3 stairs there at the hospital, and I did not have the pain that I had before surgery. The nursing care I was in ICU, so the nursing care there was absolutely superb. They were just right there, very attentive. I could not have asked for anybody to be more attentive than they were to me. The healing process, I think, is again very personal. You do need support, and I was fortunate to have my husband, so that worked out really, really well. The support at home was critical for the first few weeks anyway. He did all the cooking, all the cleaning, all the washing, all the drying, and I had Post-it notes stuck on all the machines to make sure that he knew how to do everything. And I was on that riding lawnmower on July the 4th after I had surgery on April the 20th, and I felt great.